Hi, my name is Michelle Schlossberg, and I have been an ER nurse for 5 years. I am currently enrolled in the RN BSN program at UNC Wilmington, and I'm taking a class on the evolution of professional nursing. For this class, we had to learn a little bit more about the evolution of nursing practice, and for that, I have read a book called Making Room in the Clinic: Nurse Practitioners and the Evolution of Modern Healthcare by Julie Fairman. This book provides interviews and historical insights how the role of nurse practitioner and nursing overall has evolved during the last 50 plus years. Some of the reasons nursing has evolved is due to doctor demands, constant changes in politics and social upheaval related to the general public, and in healthcare, continued to propel nursing professionals to become more of a partner to physicians when providing care. Julie Fairman has a few interesting quotes that she provided in her book as to why history is important when it comes to nursing practice. One of them is history is critical for understanding modern nursing as a practice discipline. And the other, she states she has always believed strongly in the need for nurses to develop their education and particularly to develop their scientific skills and leadership abilities. The way that history shapes identity and thinking is by teaching us a little bit about how nursing has evolved. In the 1950s and 60s, nurses were tradition bound during times of gender equality differences. They were predominantly female, lower to middle class, less educated, skilled, and trained on the job. They were treated unfairly and abused. Physicians and their assistants were typically males. They were college educated, middle upper class, refused to delegate services. But there was a shift on how doctors and nurses interacted with each other and their patients, including nursing competence and courage, increased skills and nurse education, improved perceptions, doctor shortages, and workloads. The book also spoke about early pioneers in nursing. For example, Loretta Ford developed the Nurse Practitioner Certificate Program in 1965. She was interested in expanding nurses' role, seizing upon the opportunity. The nurse practitioner movement is a result of her work on community health service and curriculum development. Nurses and physicians reconstructed their practice realities. This process was both entrepreneurial and highly ambitious. Nursing history as explanation provided context of the present and future. The same factors that led to the rise in public and healthcare institutions related to the perception of nursing professionals in the early 20th century continue to evolve as we navigate through the 21st century. Social pressures, increased entitlements to health care, and dramatic swings of the political pendulum proclaim the future ahead to be no more on solid footing than the past. In the 20th century, physicians and the public recognized the need for nursing professionals to provide quality collaborative support, and this movement will progress into the future. In my experience in the emergency department, there is a high level of collaboration between the ER doctors, the nursing staff, and the admitting physicians. All of the patients that come through the department are examined by both the nurse and the physician, and together the nurse and the physician work on a plan of care for each patient. Often the physicians will ask the nurse about the effectiveness of their plan of care and also ask of any suggestions that nursing staff may have in providing care as the patient progresses through the emergency department. I found this book to be very interesting because nursing school didn't really teach much about nursing history. Some of the things that I found very interesting were that nurses weren't as respected as they are today. Past perception of nurses were very poor. I found it very interesting how these nursing pioneers were able to pave the way for nurses to be able to further their education and advance their careers in the nursing field. What I like most about nursing are the many opportunities that are available to us as we pursue further education. I would definitely recommend this book if you'd like to understand a little bit more about how nursing practice has evolved over the last century and see how it can continue to grow even further.